Hello doctors, welcome back to Pirates of Medicine. Today we are back with a physiology based solution video. Before we start, I would like to ask you to please subscribe to the channel if you have not already, because a lot of you who watch our videos are not subscribed, and helping the channel with your subscriptions, I think that's the least to ask. Yeah. So anyway, without any further ado, let's begin. So 86th question is that osmotic pressure of a man's blood plasma is 350 milliosmol per liter and the standard pressure is 300. So first of all, it will result in high secretion of water. So osmotic pressure is increased, yes, normally is 300 and here it is increased to 350. So what happens if the blood osmotic pressure is increased? It leads to stimulation of the osmoreceptors present in the hypothalamus. We talked about this in one of the few questions before. The osmoreceptors of the hypothalamus are the first to get activated. They activate, and what do? They activate the hypothalamic and pituitary axis to secrete vasopressin. Now vasopressin, or antidiuretic hormone, it has two effects. It constricts the peripheral blood vessels and it asks the kidney to reabsorb more water. It acts on the tubules of the kidney and it leads to increased reabsorption of water. And what is the ultimate effect? That the blood volume is increased, the blood pressure is increased, and the osmotic pressure is finally decreased. Simple. So that is why osmoreceptors will be stimulated and it will result in high secretion of ADH, vasopressin. 87 is that a hypertensive glucose solution was introduced to a patient. It will intensify water movement in what direction? So basically glucose is a hyperosmolar compound, and hyperglycemia, which means increased amount of glucose in the blood, will lead to a condition called as cellular dehydration. Think of it as like this way, that this is a cell, this blue portion, and there are surrounding molecules of glucose that you just injected into the person, or maybe the person is diabetic and there is hyperglycemia. So what would happen? As you can see, there is increased amount of glucose concentration outside the cell in the interstitial extracellular fluid. Yes, to maintain equilibrium, because ultimate goal of our whole body is to maintain homeostasis. So to maintain that equilibrium and homeostasis, water will come out of the cell into the extracellular fluid so that it dilutes the area of higher concentration of glucose. So this will lead to cell shrinking or cell dehydration. Why? Because glucose is a hypertonic, hyperosmolar solution. So that is why. What direction will the water be moving? From the cell to the intracellular fluid, right? Yes. Cell dehydration. Simple. I hope you understood. So 88th is that to prevent long-term effects of 4-day malaria, a 42-year-old patient was prescribed Primaquine. On the third day from the beginning of the treatment, there appeared stomach and heart pains, dyspepsia, general cyanosis, hemoglobinuria. What caused the side effect of the preparation? So first of all, let's look at the erythrocyte and an important mechanism that you all should know. So basically our erythrocyte does not have mitochondria. So what it needs for preparation of energy is a special mechanism, and that special mechanism is HMP pathway or hexose monophosphate pathway. Now what happens in hexose monophosphate pathway is that glucose is converted to glucose 6-phosphate like every other energy glucose pathway, but here glucose 6-phosphate is converted to 6-phosphogluconate with the help of special enzyme called as glucose 6-phosphate dehydrogenase. Now this is the new substance that is formed, the 6-phosphogluconate. It enters the HMP pathway, and from there various substrates are formed which enter the glycolytic pathway, and ultimately what happens is that ATP is produced. Now what happens in HMP pathway is that HMP pathway is connected to the glutathione complex, and glutathione complex, you should already know, is an important antioxidant enzyme complex present in our body, and it helps to reduce oxidative stress. Oxidative stress is the stress caused by various free radicals free radicals and hydrogen peroxide and other like substances, and this can cause harm to the erythrocyte membrane. So what would happen? What happens is that glucose 6 phosphate dehydrogenase produces NADPH from NADP. It is kind of a symbiotic relationship. They need NADP, they give a H to the NADP, hydrogen, and the NADPH is used by the glutathione reductase to finally reduce H2O2 to H2O. So this free radical oxidative stress causing molecule is made into a normal water molecule, and the oxidative stress is reduced with the help of glutathione reductase complex, which includes glutathione reductase and glutathione peroxidase. So glutathione reductase reduces this molecule to this form, the reduced form, the oxidative form to the reduced form of glutathione, and this reduced form finally makes the H2O2 hydrogen peroxide into H2O and reduces oxidative stress. But if this enzyme is absent, the glucose 6 phosphate dehydrogenase is in less amount or deficient, it impairs the ability of erythrocyte to form NADPH, and hence glutathione reductase does not have enough NADPH to work, which will lead to they will not be able to work and oxidative stress will increase, which will cause hemolysis. Now, certain substances, certain drugs can increase oxidative stress. Like for example, in a question it was primaquine. In certain infections can increase the oxidative stress. Fava beans, Rajma's cousin, they can also increase oxidative stress. So basically the thing is that in case of G6PDH, the glucose 6 phosphate dehydrogenase insufficiency or deficiency, it can lead to increased hemolysis of erythrocytes, and all the manifestation in our patient on the background of prescribing primaquine, which increased the oxidative stress, correspond to increased hemolysis, and this is due to genetic insufficiency of glucose 6 phosphate dehydrogenase. It is an inherited disorder in which the patient or the people who have this disorder don't have enough glucose 6 phosphate dehydrogenase, or simply abbreviated as G6PDH. Okay, so 89th question is that according to audiometry data, a patient has a disturbed perception of medium frequency sounds. It might have been caused by a damage of what? So repeated question again, a quick revision. High frequency sounds are detected by the hair cells located near the main membrane of the cochlea near the oval window. Middle frequency sounds are detected by the hair cells near the middle part of cochlea. Low frequency sounds are detected by the hair cell near the main membrane of the cochlea near the helicoderma. So that is why the answer was middle part of the helix, medium frequency sound. Yes, good. So 90th is that a 17-year-old boy fell seriously ill, body temperature rose to 38.5 degree. Note that there is cough, rhinitis, lacrimation and nasal discharges. What kind of inflammation is it? So this is a pathomorphology question. Anyway, catarrhal inflammation is the inflammation of mucous membrane. Correct? It is the characteristic inflammation of mucous membrane, and mucous membrane are known for secreting mucus, and inflammation of these membranes leads to excessive thick mucus exudate, which is characteristic, and also there can be leukocyte infiltration, which causes the swelling of the mucous membrane, which normally occurs in response to any infection. Correct? So catarrhal inflammation is this, and everything that is in the question, rhinitis, lacrimation, nasal discharges, they point out toward excessive mucus. That is why catarrhal inflammation. 91st is that a patient with disturbed cerebral circulation has problems with deglutination. What part of brain was damaged? So remember, the medulla oblongata, a part of the brain stem, is responsible for various activities, like it sends innervation to the viscera of the head, thorax and abdomen. It influences the heart rate and blood pressure through the vasomotor center present in it. It regulates the breathing by the respiratory center present in it. And also the deglutination center, the swallowing center, is present in the medulla, which is a part of brainstem, and that is why our answer here is brainstem. 92 question is that a patient who has been treated with diazepam on account of neurosis complains of toothache. Doctor administered him an analgesic, but its dose was lower than the average therapeutic dose. What phenomenon did the doctor take into account while prescribing the patient an underdose? So when you are given two or more drugs together, you need to take into account what their individual have effect on each other when they are given together. Either what can happen, they don't have any effect on each other at all, correct? But if they have an accelerated effect, for example, if you give two drugs and both of them when given together have an additive effect, they combine their actions, then this is called as synergism. Now synergism can be of two types. It can be summation, in which the individual effects of both the drugs they combine together to form a produce additive effect of the both drugs. 1 plus 1 equals 2, correct? And this is very commonly seen in agents of narcosis. So in narcosis we use combination anesthesia. In combination anesthesia we use a variety of drugs, and all those drugs or all those agents they combine together to form an anesthesial effect. Now potentiation is something different. Potentiation, from the word, even grammatical word, you can understand that potentiates means to increase the effect, correct? So in this type of interaction, one drug increases the effect of another, and which leads to the pharmacologic response of both the drugs more than what it would have been if they were given individually. So for example, if you give sedative drugs with alcohol leads to its potentiation and the sedative effect is increased. Similar thing is noticed when you give diazepam with an analgesic. It leads to a potentiation, correct? So that is what our good doctor over here noticed, and this is why he reduced the therapeutic dose less than the average dose. And what phenomena did he keep into account? Potentiation. Simple? Good. A bit of pharmacology there. 93 question is that long-term starvation cure of a patient resulted in diminished ratio of albumins and globulins in plasma. What of the following will be the result of these changes? So remember, globulin and albumin are two kind of plasma proteins present in the blood. Albumin is responsible for a variety of transport functions, and globulins are of various types, and the most commonly gamma globulins, the antibodies. Yes. So we use a special measurement called as albumin globulin ratio to notice or keep a record of some measurements in the blood plasma of the plasma proteins. So the albumin globulin ratio is the ratio of amount of albumin in the serum divided by the amount of globulin. So this leads to this helps us to measure the change in the total serum protein. Normally this ratio is around 1.1 to 2.5, and this is considered normal. Now what are the conditions in which this ratio can decrease? It can be diminished. So low AG ratio can be, obviously mathematically you can see that if it is less than 1 then it will be low. Yes. And if it is less than 1, it can be of one of the following reasons. Either the amount of globulins has increased and this leads to the ratio falling less than 1, which means that overproduction of globulins like you see in infections, multiple myeloma or autoimmune diseases, and you can know that in these cases ESR will be increased as well. You must see, correct? We did this question before. So overproduction of albumin, underproduction of albumin, so if the albumin is underproduced, it also will lead to diminished albumin globulin ratio, because proportionately albumin will be less than globulin, which is seen in liver diseases like liver cirrhosis, hepatitis, correct? Also, if there is a loss of albumin from the circulation, which occurs in kidney diseases like nephrotic syndrome, again albumin to globulin ratio will be diminished. So what happens if the albumin to globulin ratio is diminished? It leads to increase in ESR, correct? Because ESR is the erythrocyte sedimentation rate. While you take a blood sample in a test tube and you note down the time it takes for the erythrocytes in the blood to settle down, that is called as ESR. So if ESR is increased, that means that the time taken by the erythrocytes will be increased. Erythrocytes, the RBCs, will take more time to settle down. This is because the plasma protein ratio, the proportion is changed, so that either albumins are underproduced or mostly globulins are overproduced, which leads to the erythrocytes taking more time to settle down. So this is mostly seen in cases when globulins are overproduced, like in infections or multiple myeloma. So that is why here the patient was long time not taking like the food, correct? Starvation, protein was not intook. So this led to in diminished ratio of albumin, because albumin was not synthesized in the liver. So underproduction of albumin, and a diminished albumin globulin ratio always leads to increase of ESR, correct? So 94th question is that a patient with decreased vasopressin synthesis that caused polyuria, as a result of it, evident organism dehydration is seen. What mechanism of polyuria development is there? So see that vasopressin is being decreased, the synthesis is being decreased. So we did just now that vasopressin, what it does is it increases reabsorption of water from the kidneys. Now if the vasopressin synthesis is decreased, what would happen? The amount of reabsorption will decrease and kidney will excrete water more. That this is what happens, that reduced tubular reabsorption of water, because vasopressin is in a low amount in the blood. And that is the mechanism by which polyuria develops. 95th is that to anesthetize the manipulation related to burn surface treatment, a patient was IV injected a medication for short-acting narcosis. A minute later, the patient under anesthesia had increased blood pressure, tachycardia, and increased tone of skeletal muscles. Reflexes remained. After awakening, the patient had disorientation and visual hallucination. What medication was the patient injected? So all these symptoms, they correspond to a special type of anesthesia called as dissociative anesthesia, which is a side effect of ketamine. Let's look at it. So ketamine is a general anesthetic administered by IV or by intramuscularly. Mechanism of action is that it stimulates all the type of receptors: dopaminergic, opioid, serotonin receptors, GABA receptors, cholinereceptors, adrenoreceptors, and it causes a special type of dissociative anesthesia. Now this dissociative anesthesia is characterized by profound analgesia, pain loss, immobility, amnesia, loss of memory with light sleep, and also the side effects include post-operative hallucinations, muscle rigidity after the anesthesia, block of upper respiratory pathway can occur, and psychomotor excitement is seen. Dissociative anesthesia is a special type of anesthesia in which the patient appears to be conscious. He opens his eyes, makes swallowing movements, the muscles are stiff, but he is unable to process sensory stimuli and does not react to them. The patient may experience tachycardia and increased blood pressure, and thus simply that the patient appears to be dissociated from the body. So these are the side effects of ketamine, an anesthetic, general anesthetic, and that is why the answer is ketamine. So 96 is that a 35-year-old man consulted a dentist about reducing the density of the dental tissue, high fragility of teeth during eating solid food. The patient suffers the most probably from the deficiency of the following mineral element. So note here that the patient is suffering from fragility of teeth, and you all know that the main mineral that makes the teeth and the bone stronger is the calcium. So that is why the patient will have hypocalcemia or calcium deficiency. 97 question is that a patient is 44-year-old. Lab exam of his blood revealed the content of proteins in plasma was 40 gram per liter. What influence will be exerted on its transcapillary water exchange? I'll repeat this question very shortly. We have done this a lot of time. Notice that the plasma protein concentration is only 40. Ideally, it should be around 80 to 100 gram per liter. Correct. Now, this patient with hypoproteinemia, what would happen? Albumin synthesis will be impaired because there is less amount of protein. Hypoalbuminemia will occur. Correct? You agree? Now, I told you albumin maintains the oncotic pressure of the blood. So, oncotic pressure is the pressure that opposes filtration in the kidney. The hydrostatic pressure, it does not oppose. It causes filtration. While the oncotic pressure, the pressure due to proteins, the pressure due to albumins, it opposes filtration. So if albumins are in a low amount, correct, because plasma proteins are less. If albumin are in a low amount, oncotic pressure will be decreased. Do you agree? If oncotic pressure is decreased, then the filtration, the only force that opposes filtration, will not be there, which will cause increased filtration, and counteractively reabsorption will be decreased. 98 says that after destruction of CNS structures, an animal lost orientative reflexes. What structure was destroyed? We did this question in the last video, the last two questions of last video. Quadrigeminal plate or corpora quadrigemina, also called as the tectal plate or the tectum. It is made by the superior and inferior colliculi, and it is responsible for orientation reflexes. So superior colliculi of the corpora quadrigemina, they are responsible for visual orientation reflexes, and inferior are involved in the auditory orientation reflexes. For example, visual means that you scan the whole book during the act of reading, or you cover your eyes in bright areas, or you turn your head towards sudden and unexpected visual stimuli. If you see in the periphery of your eyes that something is moving, yes, you move your head in that direction. So this is visual body orientation reflex. The body orientation is in response to visual stimuli. Then you have the inferior, which leads to auditory orientation reflex. Yes, for example, I call your name, that hey, and you move your head towards me, so your body reacts to the auditory signal and you change your orientation in respect to that. So this is by inferior colliculi of corpora quadrigemina. Okay, 99 is that isolated cell of human heart automatically generates excitation pulses frequency with around 60 times per minute. What structure does this cell belong to? You should know this. SA node is the pacemaker when the heart rate is 60 to 100. AV node is the pacemaker when the normal heart rate is, resting heart rate is 40 to 60. Correct? 60 when tachycardia. Ventricular Purkinje fibers are the normal pacemaker of the heart when the ppm heart rate per minute is less than 40. So I think you understand. Pacemaker SA node when it's 60, and that is why the answer is SA node. 100th question today is examination of a patient reveals strong, balanced, inert type of high nervous activity. According to Pavlov, what temperament type does this patient have? Now, Hippocrates, I agree that he was a great man. He was a great scholar. So, I mean, we have to do this question for Krok, and for your easier help, for helping you, I have made this flowchart. You can use it and you will be able to answer all these questions. So see, types of temperament: strong and weak. Weak means weak type, which is called melancholic. Strong, unbalanced, uncontrollable is choleric. Strong, balanced, inert, quiet is phlegmatic. Strong, balanced, mobile, energetic is sanguine. So strong, balanced, inert, quiet is phlegmatic, and that is what is given in the question. Strong, balanced, inert. That's why the answer is phlegmatic. Easy. Let's go to 101. Examination of a patient revealed overgrowth of facial bones, soft tissues, and tongue enlargement, wide interdental spaces with enlarged dental arc. What changes in the hormonal secretion are most likely? So you see that in the patient here we have overgrowth of various tissues. Correct? And the only hormone which helps in this much growth is the growth hormone, simply secreted by the anterior pituitary. So hypothalamus releases growth hormone releasing hormone, anterior pituitary reacts to it and releases growth hormone, also called as somatotropin. Somatotropin has various effects. It thickens the bone, it retains nitrogen and leads to muscle growth, and also it influences metabolism, it prevents cell death, it causes division and differentiation of cell, it causes growth of length of bones, so ultimately growth. That is why there would be increased secretion, hypersecretion of somatotropic hormone or growth hormone. 102 is that examination of a patient has a hemorrhage into the posterior central gyrus. What type of sensitivity on the opposite side will disturb? So posterior central gyrus is responsible for It is a primary somatosensory area, if you remember it. Yes, I have all these gyres written. You can note it down, all the functions. So postcentral gyrus, guys, it is found on the lateral surface of the parietal lobe, and it acts as the primary somatosensory area of the brain and helps to analyze the skin and proprioceptive reception. And that is why the answer is skin and proprioceptive sensitivity will be disturbed. So you can note down all these gyrus and their functions. They may ask you a question regarding that, and here also you can note it down. And anyway, without any further ado, let's begin. 103 is that child asked you to puff up a balloon as much as possible for one exhalation. What air volume will you use? So the thing is that you are being asked for a task to fill up a balloon with as much air as you can. So what capacity, what lung capacity or what volume of the lung will you use? So this type of volume in which you use all your might to fill up the balloon. First of all, you will take in air, correct? You will take a deep breath in, and then everything that you have contained in your lungs, you will empty into a balloon. You will exhale as much as you can, which will fill up the balloon. So this capacity is called as vital capacity or the vital volume of the lung. So vital capacity is the maximum amount of air a person can expel after taking a maximum inhalation. So the thing that you just did to fill up that balloon. So it is equal to the sum of inspiratory reserve volume, the tidal volume, and the expiratory reserve volume, and that is the vital capacity for you. Correct. So here 104 is that a 32-year-old patient consulted a doctor about the absence of lactation after parturition. Such disorder might be explained by the deficit of following hormone. Remember, milk synthesis depends on prolactin. Prolactin acts on the lobules of the mammary gland, which have these milk secreting cells, and it induces and maintains lactation by stimulating these lobules. And the myoepithelial cells present, they squeeze these lobules, and the milk synthesized is dropped into the ducts, and these ducts carry the milk to the areolar part, the nipple. So prolactin, remember simply, is the hormone which stimulates synthesis of milk in mammary gland. 105 is that during influenza epidemic, 40% of people who didn't go for sports were affected by the disease, and among the people who regularly did exercises, this index was only 20%. What adaptive mechanism determines such low sickness rate of pupils participating in sports? So cross adaptation is a simple type of adaptation in which the logic behind it is that if you physically exert yourself, if you do a regular amount of physical exercise, your body becomes more immune to diseases. So it is the basic principle that even we have heard from our childhood, that you need to do exercise if you want to keep yourself healthy. Not just healthy like in case of less obese, also healthy because your body's immune system works more if you exercise daily, which was seen in the survey over here. The 40% people who didn't go for sports were affected, while out of the people who went for physical exercises, only 20% were affected. So this is cross adaptation for you. 106 is that a 30-year-old woman was diagnosed with insufficiency of exocrine function of pancreas. So endocrine means hormonal synthesis, exocrine means that enzyme synthesis. So what enzyme function of the pancreas is impaired? So pancreas secretes the following enzymes. So for protein digestion, pancreas synthesizes chymotrypsin, trypsin, and carboxypeptidase. For carbohydrate digestion, it synthesizes the pancreatic amylase. For lipid digestion, it synthesizes the pancreatic lipase, the co-lipase, the phospholipase A2, carboxylester hydrolase, the pancreatic lipase related protein 2. And normally you can understand that if the exocrine function is impaired, then protein, fat, and carbohydrate hydrolysis or digestion will be disturbed. 107 is that the short-term physical activity resulted in reflex amplification of heart rate and raise of systemic arterial pressure. Hot receptor activation was the main cause of the pressure reflex realization. So notice that the heart rate and the arterial pressure increased after physical exercise. So in physical exercise, what part of your body do you use? Muscles, yes. So we have these receptors, proprioceptors present in your muscles. You have the muscle spindle present in the muscle itself, and it detects how much a muscle is stretched. And we have the Golgi tendon organ, which detect the tension of the muscle, and they provide information about the strength of contraction and tension. And then we have the joint kinesthetic receptors present in the joints, which detect the angle and movement of the joint. So what happens is that when you do a lot of work, these proprioceptors get activated and they signal the cortex, the sensory cortex, that we are being overstimulated and we need more oxygen for that. And in turn, the cortex of our brain, what it does, it activates the sympathoadrenal system, which leads to increased amount of adrenaline, and the adrenergic system, which ultimately leads to amplification of heart rate and raise of systemic arterial pressure. So this is the pressure reflex realization, which occurs due to activation of proprioceptors of active muscles. Correct? So let's go to the next one. 108 is that in course of an experiment, a skeletal muscle is being stimulated by a series of electric impulses. What type of muscle contraction will arise if every subsequent impulse comes in a period of relaxation of single muscle contraction? So I told you, we did this question before. So impulses that come from the nerves, they stimulate the muscle to contract. Now if the muscle is already contracting, for example, you are doing a work and the impulse is coming from your brain that do this, contract. So there is a intensity at which impulses comes, correct? There it won't be fixed. Sometimes the brain will send more impulses, sometimes it will send less impulses, depending on the work you're doing, correct? So when the muscle is contracting, normally what happens is that the impulse comes in the time in which the muscle relaxes, so that the muscle contracts after relaxation. But if the frequency of the stimulus, the impulse, is so high that the muscle does not have enough time to relax, then you will have the tetanus appearance in the muscle, and impulse frequency and muscle contraction graph. So see, this is the first contraction, which begins the incomplete or wave tetanus. The muscle starts to contract, and at a point it starts to relax, and then again it has not completely relaxed. It has relaxed a little, but the next impulse comes and the muscle starts to contract, and then it starts to relax, and then another impulse comes before it has relaxed completely, and then it contracts again and then relaxes, and again an impulse comes. So you can see the impulse is coming in a period of relaxation, but the frequency or the intensity, the speed of impulse is increasing. Slowly the impulse is coming very quickly, and the muscle does not have enough time to relax. So if the impulse comes in a period of relaxation of the muscle, this is called as, the relationship is called as incomplete, partial, or waved tetanus, because you can see this has a waved appearance. Yes, so this is partial or waved tetanus, in which the subsequent contraction comes in a period of relaxation. After some time, the impulse comes so quickly, the frequency is so high that the muscle does not have time at all to relax. Every impulse comes in a period of contraction only. So in this you see a smooth tetanus, or hollow tetanus, whatever you can say. And after that, the muscle fatigues. So in this, subsequent contraction impulse arrives in a period of shortening or contraction of previous muscle contraction. I hope you understand the difference, and I hope you understood why the answer there was partial tetanus. 109, simply, packed cell volume of a man was 40% before trauma. What packed cell volume will be observed 24 hours after blood loss of 750 milliliter? So after blood loss, first of all, what is packed cell volume? So packed cell volume is a measurement index used to determine the proportion of blood that is made up of cells. So you have the plasma and the blood cells. Yes. So packed cell volume is the amount of blood cells in proportion to the plasma. For example, first of all, it is expressed in percentage or the fraction of cells. For example, if PCV of 40% will mean that there are 40 milliliters of cell in 100 milliliters of blood. So it is a proportion index. So what happens in hemorrhage or blood loss? So when blood is initially lost, when the blood loss is being like the hemorrhage is there, at that moment you are losing blood, the plasma and cells at equal rate. Yes, it is not that your blood will do discrimination, that okay, lose plasma and keep blood cells. Blood loss occurs and plasma and blood cells are lost in equal amounts. So at that time, all the components are lost in equal amounts. But slowly, in about 24 hours or 23 hours, what happens is that body has this fluid present in the interstitial fluid, that is like a reserve fluid in the interstitium. Now, as a compensatory reaction to this blood loss, the body asks the blood from the interstitial fluid to come back into the blood vessels. So it comes back from the interstitial fluid into the capillaries. Now you will see that the water comes back and the blood volume is kinda restored. But still the blood cells are not restored. So you will see that the cells will be less in comparison with the plasma. Yes, the blood volume will be normal, but the proportional element of the blood cells will be less. So the packed cell volume will be less. And out of all the options given here, 30% is the only lesser amount than the previous one, the 40%. So that is why the packed cell volume will be 30%. 1110 is that a patient staggers and walk a straddle. He has hypomyotonia of arm and leg muscles. Statico speech inward section is this section localized. So classic symptoms of cerebellum lesion. We did this, you can note it down, but I hope you understand that this is a lesion of cerebellum. 111 is that a pregnant woman had her blood group identified. Reaction of erythrocyte agglutination with standard serum of first and third didn't proceed with standard serum of second group. It proceeded with the first and third, but didn't proceed with second group. Yes, so the blood group under the examination is what? Okay, so I told you a simple trick. If the blood serum, if the patient's blood does not agglutinate with any of the 1, 2 and 3 and 4, then what is his blood group? His blood group is O. If the patient's blood agglutinates with the serum of all first, second, third and not fourth, first, second and third basically, then what is his blood group? The blood group is AB. The logic behind that I'll explain it in a bit, but these two I hope you understand, that if it does not agglutinate with anyone, the blood group is O. If it agglutinates with the first, second and third, it is blood group AB. And if it agglutinates with first and third, then the blood group is what it does not agglutinate with, that is blood group A. If it agglutinates with first and second, then the blood group is what it does not agglutinate with, which is the blood group 3. The logic behind it is simple. The sera 1 contains antibody A and antibody B. So this antibody A will attack antigen A and antigen B. Yes, so if you give a patient whose blood group is O, and the blood group O does not have any antigen, so it will not cause antibody antigen reaction over here. Similarly, it will not cause over here. Similarly, it will not cause over here. But say the patient's blood group is AB. So in this case, this will attack because anti-A and anti-B is present. This will attack because anti-B is present, and this will also attack because anti-A is present in blood group in the serum third, and any person who has blood group AB will cause agglutination in all three. Now what if the patient has blood group B? So if the patient has blood group B, he will cause agglutination in first one because anti-B is present. He will cause agglutination in second one because again anti-B is present. It will not cause in third one because only anti-A is present, and anti-A will not attack antigen A, antigen B, and this shows that the patient's blood group is B. So in the patient, you go over here, agglutination occurred with first and third but not with second. So by a short trick, the blood group is what it does not occur with, blood group A, with the second blood group. Okay, here 112 is the blood group of a 30-year-old patient. Reaction was absent with first, second and third. So by a trick in the previous just question, I hope you remember that the blood group here is O, because agglutination will not occur with any of the sera if the patient's blood group is O. So that is why the answer is O. Quick question: what if the patient's blood group agglutinates with all the sera? What is his blood group? It's AB. You're correct. So 113 is that during an experiment, the myotactic reflex was studied. So after extension, skeletal muscle, the refractory contraction was absent. The reason for it might be a dysfunction of the following receptors. So before going to the dysfunction of the myotactic reflex, let's see what myotactic reflex is. So you remember I told you that there are some proprioceptors present in the muscles, the muscle spindle. So the myotactic reflex is in the muscle spindles. What happens is that the myotactic reflex is the reflex in which a muscle contracts when it is stretched. So when a muscle is stretched, the muscle spindle notes that it is being stretched and it sends the information to the CNS. But the CNS in response sends an impulse that asks the muscle to contract. So this is the myotactic reflex. The muscle stretches and in response the CNS sends a impulse that you now need to contract. So this is done by the muscle spindle. It is the receptor present over here. So when a muscle lengthens, the muscle spindle is stretched and its nerve activity increases, causing its contraction. So if the muscle spindle is impaired, it will lead to absence of this myotactic reflex, which is seen here. So the receptors caused dysfunction will be muscle spindle dysfunction. Okay, 114. So vagus branches innervating the heart are being stimulated in course of an experiment. As a result of it, the excitement conduction from atria to ventricles was brought to stop. So it is caused by the electrophysical changes in the following structures. So vagus nerve, remember I told you, is the parasympathetic innervation to the heart. Vagus nerve innervates the SA node and the AV node, and in the AV node it leads to reduction of the conduction from the atrium to the ventricle. By increasing the AV conduction will slowing down the AV conduction, and this is how it leads to a fall in heart rate. What it does in AV node, it reduces the conduction from the atria to ventricles, and obviously it brings it to a stop, and that is why the answer here is AV node, because this thing occurs in the AV node itself. 115, the last question for today. If a man has an attack of bronchospasm, it is necessary to reduce the effect of vagus on smooth muscles. What membrane cytoreceptor should be blocked? So vagus nerve, again a parasympathetic nerve, acts on the cholinereceptors present in the membrane of the bronchus. So we have the M cholinereceptors present in the membrane of the bronchus, and they detect the vagus nerve leads to parasympathetic stimulation. Acetylcholine is released in the synapse. It gets attached to this receptor, and in response, these receptors, they cause bronchoconstriction of the airway smooth muscles. It causes bronchospasm. Yes, simply. So if you want to relax the bronchus, you want to cause bronchodilation, you need to block the cholinergic receptors, the M cholinereceptor specifically. So use certain anticholinergic drugs like ipratropium bromide. So that is why the answer here is you need to block M cholinereceptors. So that is all for today, guys. We covered a lot of questions in this video, and we're going to end the physiology base in a couple of videos. I hope you find these videos helpful, and if you do, then consider giving a like to this video. Even comment us so that we know that we are being helpful to someone, and also share this video with the friends. They may also like the channel and may feel that they may find additional help from these videos. Correct? So anyway, this has been good. See you in the next one.